Well, I've decided to update the information regarding coronavirus because there are a few things that deserve a discussion. We need to understand this better. So, the first thing is that we have now more cases growing outside China than in China. In the last 4 or 5 days, we've had an augmentation of 500 cases a day in China and 1,000 cases outside China. So now it says, one of the CDC directors put it, it's not a question of if, but it's rather a question of when. When are we going to have the epidemic in our country? And this is a good question for everybody, because I think that unfortunately we will not be able to control this, and it will turn out to be a disease that is going to hit all countries in the world in a different rhythm. It depends a lot on a lot of things I'm going to show you. But anyway, we will have coronavirus for a while until we're able to have a vaccine and treatment. This will take more or less a year or two. So we can be sure that in 1 year, this will be something for the past. But until 2021, we still have to face what we will be able to do with coronavirus or not. And it's not an easy question anyway. So let's go. First, what we have outside of China with very different mortality rates. In South Korea, it's 0.5%. This is what is expected. In Italy, it's 2.3%. And in Iran, it's 7%. So how can we explain that huge difference? Well, there are a few things that came out with the Chinese Journal of Epidemiology from the Center for Disease Control of China. And these are scientific numbers that will tell us a lot. Who needs to be afraid and scared with this coronavirus and who doesn't? Well, first, good news for mamas and papas. No worries for children until they're 10. We haven't had a single case of fatality for children aged from 0 to 10. Now that's a little bit strange because with influenza, you have very severe cases with children of low age. But that doesn't happen with corona. I think corona likes the old people. Now, let's see what happens with other age ranges. And this again is the numbers we have from 44,000 cases in China that are in this Journal of Epidemiology, this scientific paper. From 10 to 39 years, mortality rate is 0.2. From 40 to 49, it doubles, 0.4. From 50 to 59, it triples, 1.3. From 60 to 69, again, 3 times, 3.6. From 7 to 79, it doubles, 8.0. And over 80, 15%. So unfortunately, we have to be very careful with old people. And old people, when they have any infection anyway, we have to be extra careful because their immune system is not the same. Now, there's another thing which is very interesting for this coronavirus and that deserves attention. Is that we've seen severe cases with people who have chronic conditions like diabetes, heart disease, lung disease, cancer treatment. So we know that these diseases happen a lot more when we're old. So that's probably what is going on with old people. Besides the immunity that goes away because old people do not have the same immunity as young people, besides the fact that immunity changes, we have a second problem, is that these people have a lot more chronic conditions than others. So as long as you're old and you don't have chronic diseases, you're more or less protected. But anyway, pay attention with immunity. Now let's talk a little bit about immunity. You know what's the most important thing for immunity is sleep. Yes, sleep. And believe it or not, 1/3 of Americans sleep less than 6 hours a day. Now, how many hours do we need to sleep? From 7 to 9. You want to be convinced you need to sleep? Well, then buy a book. It's called Why We Sleep. This book is fantastic. I assure you, not doing advertising, really. You need to read this book. One of the main things we have in life is sleep. And a good quality of sleep keeps us away from Alzheimer, diabetes, heart disease, high blood pressure. So, cancer, because it changes immunity. So please read this book. You can buy it on Amazon very easily. Why We Sleep. It's fantastic. If we think that 1/3 of Americans are not getting enough sleep, think of what might happen with their immunity. Immunity goes down when you don't sleep. So please, this is one of the main things I wanted to discuss. The second thing I wanted to discuss, which is very nice too with coronavirus, because of course, with negative things, we can always try to pick up positive things. What is it? Is that perhaps it will help people to stop smoking. Yes, because when you smoke, you have what we say a diseased lung. Don't think that you don't have symptoms and you smoke and you're okay, because this is not the case. The lung has a lot of functional reserve, so you think your lungs are fine and they're not. Second, you might have chronic bronchitis. You cough from times to times, you think it's the weather, but it's your lung and it's the smoke that you're inhaling. So, stopping cigarettes is something extremely important, and eventually part of the damage we're seeing with high fatality rates in certain countries, it's because they have more old people or more people who smoke. Iran, for example, we don't know how it goes with propaganda against smoking. We know that in the Western world, smoking has become a ban. Nobody, at least, you're told that you shouldn't smoke at all. And there's a lot of advertising for this. Eventually in Iran and China, this is not the case. One thing which is very interesting that they came out with this Chinese scientific study is that men have almost the double of fatality rate than women in China. And you know why they think that happens? Because men in China smoke a lot more than women. So please stop smoking. This might be a good idea and it might make you stop smoking, which is a very nice thing. Then the last thing that is last, but of course not least, and that's very funny. You know how many times we touch our face in 1 hour? I'm doing this right now. Well, a study published on the Journal of Infection Control, the American Journal of Infection Control in 2015, February edition, they videotaped a class in the University of New South Wales, 26 students. And you know how many times in 1 hour they put their hands on their face? Well, I'll let you guess. 5, 10, or 23. A lot of people have told me 5 times. No, it's 23 times. So we're putting our hands on the face 23 times per hour. Now, what's the dirtiest part of our body? Here, it's the hand. With the hand, we touch everything. You know that when you're in a surgical theater, you put your sterile gloves. If you touch something, just touch it, a fraction of a second. If you just touch it, you have to change your gloves because they're contaminated. So what does that mean? That means that our hands are full of germs and viruses. And with these 23 times that the students touched their face, you know, half of them, where they touched it? Eyes, nose, and mouth. And this is where the germs, the viruses, bacteria, this is where they come in and cause disease. Because if I touch here, this is the skin. Skin is protected by a layer of keratin, so it's fine. Skin is protected for infections, but not mucosas. I mean mouth, nose, and eye. So pay attention, because a lot of people are wearing masks and they think they're protected, but they're not. If you don't clean your hands quite often, well, unfortunately, you're bringing everything inside your body. And think about this, 23 times in 1 hour. So I think basically the message with this coronavirus is as follows. First, don't smoke. Second, hand is one thing, face is another one. Don't touch your face. If you want to touch it, go like this. Eventually, if you want to scratch your face, you do this. But don't touch it with your hands. Your hands are full of germs and viruses. So, every time we go to eat, wash the hands. Even if you have a toast, because you're going to have a toast, it's a dry piece of food. We put it in the mouth, so our hand touches the piece of toast, and that comes inside our body, and then we get infected. So every time we're going to eat, we have to wash our hands. Every time you want to think of touching your face, please wash your hands before you do it. And if you can, with alcohol 70% or just soap and water, wash your hands often. This is very important to keep infections away. So basically, this is the message. What about masks? Do we need to wear masks? No, we don't. People who need to use masks are people who are sick with viral infections or bacterial infections. Anyway, if you have an infection, it's not like when you have a dripping nose, a congested nose. When you have an infection, you have a fever, you feel weak, and you have a headache. When you have these symptoms with a congested nose and a sore throat, then you should use a mask to avoid spreading the viruses to other people. This is something very nice. Now, thinking that you are going to use a mask and it will protect you from other people, sometimes this is a mistake. Why? First, because we touch the mask a lot of times. So if you need to adjust the mask, you go like this. When you do this, you're close to the eye. If you're close to the eye, there comes the virus. So it's not such a protection. And people who need protection is doctors and nurses who are going to deal with people who have these secretions and the droplets that bring up the viruses. So these are the people who need masks. All other peoples don't. What we need is to wash our hands. And the last thing, good hygiene when you have a cold. Please cough like this. This is very important. We cannot cough like this. You have to teach everybody to cough like this, because when you shake hands, you're not shaking the elbow, of course, right? So this is basic. And if you need to clean your nose because it has a lot of phlegm, please wash your hands carefully after this. You have a lot of tutorials on internet on how to wash your hands. I'm not going to repeat this, but this is very important. And soap and water is very nice for coronavirus. You don't need alcohol at 70%. Alcohol with 70% degree is just easier to use because you don't need a towel, you don't need a bathroom, but that's all. Okay, so that's it for now, and as soon as we have more news, I'll produce a second video. Bye.